Fantastic, by the way. This congressman, Representative Robert Bresnahan, sold his Centene stock, dumped it. Okay? Centene provides healthcare exchanges for Medicaid. This congressman literally dumped stock in a Medicaid provider company right before this bill came to the floor. Don't be fooled. These guys know exactly what they're doing. Now, before you say insider trading, chat, it's worse than insider trading. Do you want to know why it's worse than insider trading? Because he's literally, like, he has the capacity to make or break this as a congressperson. Okay? It's not just that, like, oh, he knows that they have the votes for it, so this is the most opportune time to dump it. It's worse. It's market manipulation when you think about it. I love American GDP. Line goes up. Line goes up. Because this is what I saw. And it's like he literally called the bottom. And I was like, yeah, I wonder why he called the bottom. Yeah, because he's the president. I love American GDP. Line goes up. Line goes up. He didn't call the bottom. He created the bottom. And then he literally tweaked the faucet that was making the market bottom out. And right before he tweaked the faucet, he said, great time to buy. I love American GDP. Line goes up. Line goes up. Are these people that dumb? Are they this stupid? I guess the answer is yes. Thank God someone responded to it and said, wait, why does this have 32K likes? Lol. Of course he called the bottom. He caused the bottom, and then he decided to end it. Guy who single-handedly destroyed the economy tells everyone he is done destroying the economy. Anyone else does this and the SEC rails their brains out? No, they don't. No, they don't. You want to know why? Because the SEC is a carcass now. Okay? They don't even do that anymore because guess what? Donald Trump and the vultures that he brought into office gutted every institution, every regulatory body, including the SEC. Like, yes, in a functioning government, the SEC is supposed to go, hold on, what do you mean? This is, like, all of this stuff doesn't seem too legal to me. What happens to people that don't have Medicaid? It's already an insane process to qualify for this stuff. There are chatters in here who qualify for it. Good luck to the rural hospitals that rely on Medicaid to actually stay afloat, because all of the people that live in these areas, these red areas that voted for Donald Trump, that are on Medicaid, but they don't realize that they're on Medicaid because every state has a different name for it. If you're in Nebraska, it's called Access Nebraska. If you're in Nevada, it's called Nevada Medicaid. But if you're in, like, California, it's called Medi-Cal. You don't know. That's not Medicaid. It's Medi-Cal. Connecticut is Husky Health. When is this supposed to go into effect? After the fucking midterms, chatter. Don't worry. They didn't want you to immediately feel the pain and then turn around and vote against the Republican Party, God forbid. In fact, the Democrats in state control could increase income taxes on the rich and redistribute that middle and working class. All they'd have to do is do it. Before you insist Dems have no power to reduce Trump tax cuts for billionaires they say they oppose, remember, they have the power to now try to change state tax laws or to effectively repeal or reduce those tax cuts in 15 states where Dems control the legislature and governorship. That is what a serious opposition party would do, but it's not clear Dems are a serious opposition. Example. And then the example David Sirota uses is Kathy Hochul's refusal to fucking pass even a modest increase in the super wealthy that Zohran Mamdani was suggesting for New York City. Ultimately, there are, in the 99% of Americans, there are plenty of fucking people that actually rely on these social safety nets, don't even realize that they rely on these social safety nets, and constantly advocate for their own demise. It is very frustrating. We see them in this chat every fucking day. They come to me, a guy living in fucking California, a guy that already has like a decent amount of money, who is fortunate enough to be able to take care of his own fucking family. And they say, from their position of a working class American that relies on these social safety nets, they say, you fucking idiot, get wrecked. Oh, I bet you're malding now. It's like, yeah, I am, because clearly I care about your fucking parents than you do. That's why I'm malding. If you rely on Medicaid or SNAP, you rely on the safety net. What are you talking about? Do you personally think that in rural areas, there aren't a ton of people that rely on both SNAP or some form of social safety nets that are going to be cut, especially when it comes to Medicaid. There are different names for it in every state. People don't even realize. People don't even realize that their fucking Medicaid is getting cut because they don't think it's Medicaid. They think it's something else. Okay? Do you not realize that there are a ton of people who are like, oh yeah, no, this is great. Trump's got me. He's got me. He's actually going to defend me. I'm so glad I voted for him. What a massive W. Meanwhile, Trump is about to pass a bill that is going to gut their health care.
Why would I care about Medicaid? I have private insurance. Well, when uninsured people go to the hospital, they still get treated, especially if it's an emergency. And if they can't pay for those treatments, the hospital has to. So if you imagine 20% of the services that a hospital is offering are not being paid for, they have to raise prices for everyone else to cover that 20%. So then my insurance gets charged more and then they pass it off to me so my prices go up too. Yeah, exactly. Sign this? Oh. Wait, but the 20% has to be paid no matter what. So either it comes out of higher insurance rates or it comes out of Medicaid, which is paid from my taxes. I mean, I'm paying the same amount either way, right? Well, not quite. Because when people don't have Medicaid, the pool gets even bigger, which means that you pay more to make up for that. That doesn't make any sense. You said that hospitals have to cover lost income, not that their costs actually go up. Well, Medicaid gives people insurance, which is different than people not having insurance at all. Well, yeah, duh. Yeah, fair. What I meant is that when people have insurance, they're more likely to get preventative care. When they don't, they're probably waiting until it's an emergency. But emergency rooms are already astronomically more expensive to operate than primary care. And on top of that, people are now coming in with more complicated problems that require more expensive services, which cost hospitals.
By the way, the hospital system is already busted right now in this country, partially as a consequence of private healthcare and the way that we have refused to nationalize the healthcare system in general. Okay? Hospitals already rely on donations to begin with. They rely on government subsidies to begin with to even operate. But then also on top of that, they are for profit. Okay? There's only one aspect of the hospitals where they can't deny you some kind of health care, and that is emergency rooms. So the emergency rooms are basically fucking overcrowded all the time. It is it's unironically a Band-Aid solution to long-term care. If people actually had the opportunity, if hospitals were free, if the healthcare system was nationalized, and people had an opportunity to go to the doctor more frequently, they would be less reliant on the emergency rooms. So when the emergency rooms are constantly overloaded, the quality of care diminishes as a direct consequence of that. Okay? And they can't deny you coverage. They can't deny you healthcare in an emergency room. You're fucking dying. They have to treat you. A lot of the people that use the emergency rooms don't have the money to pay for that that treatment. Okay? So then hospitals will take that treatment that they just gave away to this person who was too poor to pay for it and slam that into other treatments that they can do to other people that have healthcare. This is how your fucking premiums go up for private insurance as well. The greatest way to diminish the stress that emergency rooms experience is, of course, long-term preventative care. Going to general practitioners, having a general practitioner to begin with, and being able to go and visit them frequently, and have your doctor give you advice on what to do and what not to do, so that you don't have these sorts of issues. But we don't do any of that. We don't do any of that shit in this country. Everything is so busted. But hey, guess what? It's fantastic for the GDP. Do you understand? It is fucking amazing for the GDP. It makes my hard how hard this entire sector that literally is just a expensive middleman that should not exist gets to exist and gets to get so much fucking government subsidies in the process. Oh, I love it, dude. I fucking love American GDP. Line goes up. Line goes up. I love when the line goes up. An entire fucking $1 trillion sector that literally should not exist.
Even more money, so then the pool gets bigger. And then on top of that, you have to think about what happens when hospitals start closing. I have to drive further to get medical care. Maybe, but I mean, think about this. Even if you're in a nice area, some hospitals, especially in rural areas, have a higher percentage of patients that use Medicaid. And if they're not getting paid from Medicaid, they probably can't stay open. Then those hospitals probably shouldn't be open. If they need a government handout to be profitable, well, it's not a handout. Those hospitals are doing the exact same services as other hospitals. It's just due to who their patients are, the insurance that's
Also, yeah, government handouts for hospitals. There's not a single hospital in the fucking nation that does not get a government handout, quote unquote. And they should. It should all be free. Every part of this should be dealt with through the government. There should be no profit incentive in any part of this process. Healthcare is an inelastic demand service, okay? Without it, you fucking die. This is literally Econ 101. It's not even, this is what you learn in the econ classes that you take. I can love American GDP. Line goes up. Line goes up. They don't pay a lot of attention to this concept after they just say inelastic demand and then they move on. And you're not supposed to think like, wait a minute, healthcare seems like that's an inelastic demand, which means that there needs to be severe government intervention, severe government regulation over this, because clearly if there's inelastic demand, that means that the people who are supplying could like set the prices to whatever they want to, and people still have to get it. Otherwise, they fucking die. Can love American GDP. Line goes up. Line goes up. Healthcare and pharmaceuticals and every part of the hospital system, every part of the healthcare system has to be not for profit. It's alarming that we have this concept and we're trying to eradicate this as well for the USPS, right? The United States Postal Service. It's not supposed to be for profit. Everybody understands, or at least most people understand, that it's not supposed to be for profit. It's a service that needs to exist, okay? You can apply that principle to healthcare as well, or should apply that principle to healthcare as well. But people seemingly don't do that.
Reimbursing them is Medicaid. If they close, that means that there's more people in my emergency room the next time I fall off a ladder? A ladder did that to you. Oh, yeah, well, I fell on a pipe. Oh, okay. Well, I mean, it's everyone's emergency room. The thing is that those hospitals are competition. Hospitals want to make money too, and if they don't have competition, they're going to raise their prices. So even though I have private insurance, kicking people off Medicaid means that you're doing work that you're not being compensated for. So you need to raise your prices, which means passing that on to my insurance company, who then passes it on to me, which means I have less money. It also means that I drive further and wait longer for probably more rushed medical care. Yeah. Okay. And you just had to tell me about this before you could sew me back up? Right. Yeah. So your insurance is saying that they are not going to cover what they consider an optional cosmetic operation? Yeah, I can make that work.
It's already happening. Curtis is a small town of 900 people in rural southwest Nebraska. The Curtis Medical Center announced yesterday it is closing after more than 30 years. It is the only healthcare provider in the community. They blame Trump's Medicaid cuts.
And this just into our newsroom, a medical center in Curtis deciding to close. This after serving the community for more than 30 years. Now, the Nebraska Hospital Association claiming anticipated Medicaid cuts may have impacted the clinic's closure. We're told the transition to close will take place over the coming months.